Hey, often seniors will say, what causes the highest cost in healthcare when it comes to Medicare? I'm going to be covering exactly what are the highest cost and what creates the highest cost, and then what you should be doing about that in this upcoming video. Stick around. I'll be back in just a minute to cover that with you. Hey guys, we're going to dive in today about what creates the highest cost in Medicare and then exactly how do you cover these costs. This is a very important topic. A lot of times Medicare beneficiaries are extremely confused about what health plan to choose. A lot of times they're looking at Medicare Advantage or Medicare Supplement plan. They're trying to figure out exactly what's going to cost me the least amount of money or provide me the highest quality of care. And really it's just by to be honest with you, it's really by choice what you feel most comfortable with. But if you stay on original Medicare, there's extremely high cost out of pocket that you can be exposed to, which is what creates the highest cost in Medicare. And then how do I cover those costs? One, we're going to break down today Part A of hospital, Part B is medical when it comes to original Medicare. And these are the two biggest components of Medicare that can create the most cost. In all simplicity, it has a Medicare Part A deductible. Depending on what year you're in, the deductible typically is going to adjust what they call as a cost of living adjustment, the COLA. And right now it's $1,632 deductible, and that's for every 60 days that you've stayed within a hospital stay. So if you go to the hospital and you stay up to 5 days and you come out within that 60-day window, if you go back into the hospital, you don't pay the deductible. But if you don't go back into the hospital and it's 61 days and beyond, you pay that deductible for every 60 days you've been in the hospital. Actually, you have some additional costs that go along with if you stay day 61 through 90, you can have up to $11,832 cost if you stayed 91 through 150 consecutively. Now, is that going to happen? Probably not, but the reality is that some people are exposed to certain chronic illnesses, disease. You have a catastrophic event occur and you're in the hospital for a long period of time and exposes you to these higher dollar costs. So day 91 through 150, you actually are going to use up what they call the lifetime reserve days that Medicare gives you. It's 60 days allocated toward your lifetime. And so at 91 to 150 days, you actually use up your lifetime reserve days, which means one, you're going to pay a $48,144 cost to stay in the hospital. And if you add all those together, your deductible, day 61 through 90, day 91 through 150, the total cost is going to be $61,608 that you're going to be coming out of pocket just to stay in the hospital. That's for Part A services, just for hospital. That's not excluding all the Part B services that are going to happen outpatient. So at some given point, you're coming out of the hospital and you're still exposed to the Medicare Part B deductible. Right now it's $240 plus the billable rate of 20% that Medicare is going to charge you. So how do we simplify that down? When you have Medicare A and B, there's really a big question mark on exactly how much am I going to be charged throughout the given year. There's no stop loss. If you owe the deductible, you pay it. If you owe the co-insurance, you pay it. Now let's shift into why the importance of you understanding the Medicare health plans that are available to you. And this is where we dive into deeper detail in this video series and a lot of other material that we provide, whether or not you're going to choose a Medicare Advantage plan, which are HMO or PPO driven plans. As you've heard me say before, those plans work exceptionally well in high areas that are metro areas or in and around metro cities. So we're right outside of Nashville, Tennessee. They will often want to choose a Medicare Advantage plan because it's a zero premium, there's no deductibles, and they pay small to very little co-pays for most access to care to normal things. And then if they're exposed to like a hospital stay, they pay a little bit higher copay cost. And we break that down in other videos and stuff that we go over. But the risk, the max out of pocket for these plans, what they call a max out of pocket or MOOP, these plans are regulated by Medicare. So Medicare has this max amount of $8,850 this year. The most you're going to pay out of pocket is the max out of pocket. So those plans have a max. Medicare has no stop loss or has no max. So whatever you owe on original Medicare, it's going to come out of your pocket. With a Medicare Advantage plan, you're going to have a max. When they enroll into one of those choices of plans, if it covers the doctors, the specialists, the medications, they're going to get additional things like dental, hearing, vision, and things like that. But a lot of times they're looking at that plan because they say, hey, you have incredible coverage, but at the same time, you're not paying a cost per month And then when you do access care and you do use it, you're going to have small to low co-payments typically. And then for major things like surgeries, hospitalization, and things like that, you're going to have a copay amount or up to a few days of copays in a hospital, and then everything's covered by the plan. So the max exposure on most of those plans are very limited. The golden handcuffs, as I like to call them, are there are certain times when prior authorization from the doctor has to go through the plan to authorize a surgery or certain procedures and things like that. So with original Medicare, there is prior authorization. The process to speed it up and have things done a little bit quicker. Original Medicare allows for. Medicare Advantage plans have a process, and so the doctor's involved and the specialist is involved, and they usually run that through the carrier. And then you can always expedite an appeal if something's turned down. It's a 72-hour expedited appeal process. They come back with an answer. So I always like to say this: if you are like, I never like to hear a no, and I want to always hear a yes when I want something, then you know what? I don't know what to tell you, because neither original Medicare or Medicare Advantage or Medicare Supplement is going to provide you without any problems to how you access care beyond you always have access care with a Medicare Advantage plan or original Medicare when it comes to going to either A, emergency, urgent care. With a Medicare Part A and Part B, you're going to always have open access to any doctor that accepts original Medicare. With Medicare Advantage plans, you're always going to have open access to the network of doctors and specialists that take that. But at the end of the day, that is a plan choice that eliminates the lowered out-of-pocket risk that original Medicare can create. The other option is staying on original Medicare and then paying for the Medicare supplement. And typically, most of our clients do a Plan G. That just means your Medicare Part B deductible is owed each year. Then 100% of Part A and Part B services are covered. And then you would choose a drug plan, have a small premium that's going to cover the majority of your drug costs, and some copay costs would be owed by you. Just like on Medicare Advantage plans, most of our clients enroll into a plan that has a drug benefit built into it. They call those Medicare Advantage prescription drug plans, or the acronym MAPD is what we use. So come back to this age-old question of, what exactly creates the highest cost in Medicare? Well, I simplify it like this: not doing anything, just going on the original Medicare. And then how do I cover them? You move in the direction of either a Medicare Advantage plan or a Medicare Supplement plan. Now, we have a workshop we provide. It doesn't cost anything. I talked about it at the very beginning, that goes over how all those plans work, all the moving parts of Medicare, and really allows you to really dissect and figure out what is best for you. Clicking below, signing up and registering for either the on-demand workshop or one of our live workshops. And you can also go out to our website at medicarehub.org and sign up there as well. If you have additional questions, give us a call. We'd love to be able to talk to you and provide some guidance to you. It doesn't cost anything. It's a quick way to be educated on your options. Guys, until next time, I will talk to you and see you on the other side.